Hey there, I'm so glad you clicked on this video today. If you've been waking up exhausted even after a full night's sleep, if your partner has mentioned that you snore loudly or stop breathing during the night, or if you find yourself struggling to stay awake during the day no matter how much rest you think you're getting, then this video might just change your life. Today, we're talking about sleep apnea, a condition that affects millions of people worldwide, but often goes undiagnosed for years. I'm going to walk you through the warning signs, help you understand what's really happening in your body, and most importantly, show you the solutions that can help you reclaim your energy and health. Now, before we dive in, I want to ask you something. Have you ever experienced any of these symptoms? Or do you know someone who has? Maybe you've been told you snore, or you wake up gasping for air, or you just feel like no amount of sleep is ever enough. Drop a comment below and let me know what brought you here today. Your experience might help someone else realize they're not alone in this. Let's start with the basics. Sleep apnea is a sleep disorder where your breathing repeatedly stops and starts throughout the night. Now, I know that sounds scary, and honestly, it should get your attention because untreated sleep apnea isn't just about being tired. It puts serious strain on your heart, increases your risk of stroke, diabetes, and high blood pressure, and can dramatically affect your quality of life. But here's the good news. Once you recognize the signs and take action, this condition is very manageable, and many people see life-changing improvements. So what are the signs you should be watching for? The most common symptom is loud, chronic snoring. Now, not everyone who snores has sleep apnea, but if your snoring is loud enough to disturb others, and especially if it's accompanied by choking or gasping sounds, that's a red flag. What's happening is that the airway is becoming blocked, usually because the muscles in the back of your throat relax too much during sleep. This causes a temporary pause in breathing, which your brain detects, and then you partially wake up to restart your breathing. You might not even remember these awakenings, but they're fragmenting your sleep and preventing you from getting the deep, restorative rest your body desperately needs. Another major sign is excessive daytime sleepiness. I'm not talking about feeling a little tired in the afternoon. I'm talking about struggling to stay awake during meetings, while driving, or during conversations. You might find yourself nodding off while watching TV or reading, even though you think you slept all night. This happens because your sleep quality is so disrupted that your brain never gets the chance to complete those crucial deep sleep cycles. Morning headaches are another telltale symptom. If you're regularly waking up with a headache, especially one that feels like pressure or tightness, it could be because your oxygen levels are dropping during those breathing pauses. Your brain isn't getting enough oxygen, and that leads to those uncomfortable morning headaches. Pay attention to your mood and mental clarity too. Sleep apnea doesn't just make you tired, it affects your brain function. People with untreated sleep apnea often experience difficulty concentrating, memory problems, irritability, mood swings, and even depression. If you've noticed that you're more forgetful, more easily frustrated, or just not feeling like yourself mentally, sleep apnea could be a hidden culprit. And here's something that surprises many people: waking up with a dry mouth or sore throat. When you're breathing through your mouth because your airway is blocked, you wake up feeling parched and uncomfortable. Night sweats are also common because your body is working so hard to breathe and constantly waking up from those apnea episodes. Now, let's talk about who's at risk. While sleep apnea can affect anyone, including children, there are certain factors that increase your likelihood. Being overweight is one of the most significant risk factors because excess tissue around the neck can obstruct the airway. Having a thicker neck circumference, being male, being older, and having a family history of sleep apnea all increase your risk. Certain physical characteristics matter too, like having a narrowed airway, large tonsils, or a recessed chin. And lifestyle factors like smoking and alcohol use can relax your throat muscles and worsen sleep apnea. But here's what I really want you to understand. Even if you don't fit the typical profile, you can still have sleep apnea. I've seen thin, young, healthy-looking individuals who were shocked to discover they had moderate to severe sleep apnea. So please don't dismiss your symptoms just because you don't match every risk factor. So what should you do if you recognize these signs in yourself? The first and most important step is to talk to your doctor. I know it's tempting to self-diagnose or just hope it gets better on its own, but sleep apnea requires proper evaluation. Your doctor will likely recommend a sleep study, which can be done either in a sleep lab or sometimes at home with a portable monitor. This study measures your breathing patterns, oxygen levels, heart rate, and brain waves while you sleep, giving doctors a clear picture of what's happening throughout the night. Once diagnosed, there are several effective treatment options, and the right one for you depends on the severity of your condition and your individual circumstances. The most common and effective treatment is CPAP therapy. CPAP stands for continuous positive airway pressure, and it involves wearing a mask over your nose or mouth while you sleep. The machine delivers a steady stream of air that keeps your airway open. Now, I'll be honest with you, it takes some getting used to. Many people struggle with it at first, but modern CPAP machines are quieter, more comfortable, and come with various mask styles to fit different preferences. And the results can be absolutely incredible. People often tell me they can't believe how much better they feel after just a few nights of using CPAP properly. For mild cases or for people who can't tolerate CPAP, there are oral appliances that a dentist can fit for you. These devices reposition your jaw and tongue to keep your airway open during sleep. They're smaller and more portable than CPAP machines, though they're typically not as effective for severe sleep apnea. Lifestyle changes can also make a significant difference, especially for mild to moderate cases. Losing even 10% of your body weight can dramatically improve or even eliminate sleep apnea for some people. Sleeping on your side instead of your back helps too, because gravity is less likely to cause your tongue and soft tissues to block your airway. Avoiding alcohol and sedatives before bed, quitting smoking, and establishing a regular sleep schedule all support better breathing during sleep. In some cases, surgery might be recommended, particularly if there's a structural issue like enlarged tonsils or a deviated septum that's contributing to the airway obstruction. But surgery is usually considered only after other treatments haven't worked. Here's something crucial I need you to understand. Treating sleep apnea isn't just about feeling more rested, though that's wonderful. It's about protecting your long-term health. Untreated sleep apnea puts enormous stress on your cardiovascular system. Every time your oxygen drops and you partially wake up, your blood pressure spikes and your heart works harder. Over time, this significantly increases your risk of heart attack, stroke, irregular heartbeat, and heart failure. It also worsens insulin resistance, making diabetes harder to control, and the daytime sleepiness increases your risk of accidents both at work and while driving. But when sleep apnea is properly treated, the benefits are remarkable. Your energy returns, your mood improves, your concentration sharpens, your blood pressure often drops, your risk of serious health complications decreases dramatically. Many people tell me that getting their sleep apnea treated was life-changing, that they finally feel like themselves again. So if you've been recognizing these symptoms in yourself, please don't wait. Talk to your doctor, get evaluated, advocate for yourself if you need to. Sometimes people mention their symptoms and are brushed off, especially if they don't fit the stereotypical image of someone with sleep apnea. But you know your body. If something feels wrong, pursue answers until you get them. And remember, this is a journey. If the first treatment option doesn't work for you, there are others to try. If your CPAP mask is uncomfortable, work with your supplier to find a different style. If lifestyle changes alone aren't enough, don't be discouraged. Be open to adding medical treatment. The goal is to find what works for you and stick with it. Your sleep matters, your health matters. You deserve to wake up feeling refreshed and ready to take on your day. You deserve to have the energy to do the things you love and be present for the people you care about. Sleep apnea might feel overwhelming right now, but it's treatable, and you don't have to live with these symptoms. Thank you so much for watching today. If this video was helpful, please give it a thumbs up and subscribe for more health content that empowers you to take control of your well-being. And again, drop a comment below sharing your experience or questions. I'd love to hear from you. Take care of yourself, and here's to better sleep and better health ahead.